Ever wondered why liver transplants are so crucial? Take a moment and think about your liver. This organ, tucked away in your abdomen, is a silent yet indispensable hero. It's the body's chemical processing plant, tirelessly working to detoxify your blood, produce bile to aid digestion, and store essential vitamins and minerals. Without a fully functioning liver, our body's ability to process nutrients, fight infections, and maintain hormonal balance would be severely compromised. Now imagine this powerhouse of an organ failing. The consequences are dire and often life-threatening. This is where liver transplants come into the picture. A liver transplant is the replacement of a diseased liver with a healthy one, often from a donor. This procedure is typically the last resort for individuals with end-stage liver disease, a condition where the liver has sustained irreversible damage. There's a common misconception that liver transplants are only for those suffering from alcohol-related liver disease. While it's true that chronic alcohol abuse can lead to liver damage, it's not the only cause. Many liver transplant recipients suffer from conditions such as cirrhosis, hepatitis, or genetic disorders like Wilson's disease. Another myth is that liver transplants are a temporary solution with a bleak outlook. On the contrary, with modern advancements in surgical techniques and post-operative care, many recipients lead long, healthy lives post-transplant. Liver transplants are not merely about replacing a failing organ. It's about giving someone a second chance at life. It's about transforming a life marked by constant illness and hospital visits into one of health and normalcy. The importance of liver transplants cannot be understated. They are a testament to the marvels of modern medicine, a perfect blend of science and compassion, where the gift of life can be passed from one person to another. So, liver transplants are not just life-saving, but life-transforming procedures. Understanding the liver transplant process can help demystify it. Let's break it down into easy-to-understand steps. First, we start with the decision to transplant. This is made when a patient's liver can no longer function adequately, a condition often referred to as liver failure. The reasons for this can be many and varied, ranging from cirrhosis and hepatitis to genetic disorders. Next, we move on to the evaluation process. This is a comprehensive review that includes medical tests and consultations with specialists. The goal here is to determine whether a transplant is the best treatment option for the patient. This process also helps to ensure that the patient is physically capable of undergoing the transplant surgery and the rigorous post-operative care. Once the decision is made and the patient is deemed suitable, they're placed on a waiting list for a donor liver. The duration of this wait can vary greatly due to factors such as blood type, body size, and the severity of the patient's condition. Now let's talk about the surgery itself. During a liver transplant, the diseased liver is removed and replaced with a healthy one from a donor. This complex procedure can take anywhere from 4 to 12 hours. The specifics of the surgery vary, depending on the patient's condition and the type of transplant, whether it's from a living donor or a deceased one. Post-operative care is the final step of the process. After the surgery, the patient is closely monitored in the intensive care unit, or ICU. Over time, as the patient stabilizes, they're moved to a regular hospital room. The recovery period is critical, involving regular checkups and a regimen of medication to prevent the body from rejecting the new liver. The liver transplant process is a complex journey that requires a dedicated team of healthcare professionals. Each step, from the moment the need for a transplant is identified to the long road to recovery, is crucial in ensuring the best possible outcomes for the patient. And that, in a nutshell, is the journey from identifying the need for a liver transplant to recovery. Before diving deeper into the transplant process, let's discuss why one might need a liver transplant. The liver, as you might know, is a vital organ that performs numerous functions, including detoxifying harmful substances, metabolizing drugs, and making proteins for blood clotting. When this powerhouse of an organ is compromised, the effects can be severe and potentially life-threatening. A common reason for liver transplant is cirrhosis, a condition where the liver cells are damaged and replaced by scar tissue. It's often caused by chronic alcohol abuse or hepatitis B and C. Cirrhosis can lead to complications such as jaundice, which manifests as yellowing of the skin and eyes, and portal hypertension, which can cause bleeding varices or swollen veins in the esophagus. Another liver disease that could necessitate a transplant is liver cancer, specifically hepatocellular carcinoma. This cancer starts in the liver, unlike other cancers that spread to the liver from other parts of the body. Symptoms might include a lump or pain on the right side beneath the rib cage, loss of appetite, or unexplained weight loss. Now, let's talk about the anesthetic implications of these diseases. Anesthesia is a critical part of any surgical procedure, but in patients with liver disease, its administration requires extra caution. The liver metabolizes most anesthetic drugs, so in a diseased liver, the rate of drug metabolism can be unpredictable. This can lead to increased sensitivity to drugs and a prolonged recovery period. Additionally, patients with liver disease often have coagulation problems because the liver produces clotting factors. This can lead to increased bleeding during surgery, which is a significant concern for anesthesiologists. Lastly, liver disease patients may have compromised cardiovascular and respiratory systems. The anesthesiologist must closely monitor these systems during surgery to prevent any complications. In conclusion, liver diseases such as cirrhosis and liver cancer can lead to serious complications, making a liver transplant necessary. Anesthesiologists play a crucial role in managing these patients during the surgery. Knowing the signs of liver disease can lead to early detection and treatment. The journey to a liver transplant begins long before the surgery itself. A critical step in this journey is the preoperative evaluation, a comprehensive process that involves a variety of tests, consultations, and preparation measures. This is where we gather a complete picture of the patient's health status, which allows us to anticipate potential challenges and prepare accordingly. The preoperative evaluation typically begins with a battery of tests. These may include blood tests to assess liver function and overall health, imaging studies like ultrasounds or CT scans to get a detailed view of the liver, and heart and lung tests to ensure the patient can withstand the rigors of surgery. In some cases, a liver biopsy might be necessary to determine the exact nature and extent of the liver disease. Next, the patient will have consultations with various healthcare professionals. This team usually includes a hepatologist or gastroenterologist, a transplant surgeon, a transplant coordinator, a dietitian, a social worker, and possibly others based on the patient's specific needs. Together, they will assess the patient's eligibility for a transplant, discuss the risks and benefits, and provide education about the procedure and the post-operative care. The patient's preparation for surgery is another crucial part of the preoperative evaluation. This involves optimizing their physical health through a balanced diet and regular exercise, addressing any existing health conditions, and ensuring they understand the importance of taking their medications as directed. Importantly, the evaluation also takes into account the patient's mental and emotional well-being. The psychological impact of a liver transplant can be significant, so it's essential to ensure the patient has a strong support system in place and access to mental health resources if needed. Lastly, the patient will be educated about the need for lifelong follow-up care and medication adherence to maintain the health of the transplanted liver. In conclusion, the preoperative evaluation is a multifaceted process that plays a pivotal role in a patient's liver transplant journey. By thoroughly assessing a patient's health status and preparing them for what's to come, we can significantly enhance the likelihood of a successful transplant and a speedy recovery. A thorough preoperative evaluation is vital to ensure the best possible outcomes. The centerpiece of the liver transplant process is, of course, the surgery itself. This is where medical expertise, cutting-edge technology, and sheer human resilience come together in a grand symphony of healing. Let's break it down in simpler terms. The procedure begins with the removal of the diseased liver. This is a delicate process, as the liver is not only large but is also intricately connected to several major blood vessels. Surgeons navigate this complex network with precision, ensuring that vital structures are preserved while the diseased liver is carefully excised. Next comes the placement of the new liver. This donor liver, having been carefully matched for compatibility, is introduced into the body. It's a bit like moving into a new home. The liver needs to be positioned just right, connected to the right blood vessels, and fixed in place. This is where the real magic happens. The surgeon meticulously stitches the new liver into place, reconnecting the maze of blood vessels and bile ducts. It's a bit like solving a three-dimensional jigsaw puzzle, where every piece is vital and there's no room for error. Throughout this process, the patient is closely monitored. Sophisticated medical equipment tracks vital signs, ensuring the patient's safety and providing real-time feedback to the surgical team. It's a dance between man and machine, with the shared goal of saving a life. And then there's the human factor, the resilience of the patient who's battling a serious illness, the skill and dedication of the surgical team, who've trained for years to perform this intricate procedure. The generosity of the organ donor, who's given the gift of life. It's a beautiful, complex ballet of science, skill, and humanity, and it's not without its challenges. Complications can arise, requiring quick thinking and expert problem solving. But with advancements in medical technology and surgical techniques, liver transplant surgery has become increasingly efficient and safe. Though complex, liver transplant surgery has become increasingly efficient and safe. It's a testament to how far we've come in the field of medicine and a beacon of hope for those battling liver disease. The journey doesn't end with the surgery. Indeed, the post-operative period following a liver transplant is as crucial as the surgery itself. It's a time of close monitoring, precise medication, and vigilant care. Let's delve a bit deeper into this critical phase. After the surgery, the patient is transferred to the intensive care unit where they are closely monitored. Doctors and nurses keep a keen eye on vital signs like blood pressure, heart rate, and oxygen levels. If necessary, blood products are administered to replace any significant blood loss during surgery. The patient is also hooked up to various monitors and lines. These are instrumental in tracking the patient's progress and detecting any early signs of complications. While the sight of these monitors and lines may seem intimidating, remember, they are there to ensure the patient's safety and recovery. Medication plays an integral role in post-operative care. Patients are typically prescribed immunosuppressant drugs. These drugs help prevent the body from rejecting the new liver, a potential risk following any transplant surgery. It's essential to take these medications as directed by the healthcare team. It's also worth noting that the liver, being the body's detoxifier, plays a significant role in drug metabolism. Hence, the dosages of these medications may need frequent adjustments, especially in the early post-operative period. Potential complications following a liver transplant can include infection, bleeding, or blockage of the blood vessels to the liver. Thus, prompt identification and management of these complications are of utmost importance. Follow-up care is another key aspect of the post-operative period. Regular checkups allow the healthcare team to assess the liver function, monitor for signs of rejection, and adjust medications as needed. It also gives patients an opportunity to discuss any concerns or issues they may be facing. In conclusion, the period following a liver transplant is a time of careful monitoring, medication management, and follow-up care. While it can be a challenging time for patients and their families, remember, each step in this journey is geared towards ensuring the success of the transplant. Post-operative care is critical in ensuring the success of a liver transplant. Let's recap some of the key points we've discussed today. We started by understanding the importance of liver transplants, a life-saving procedure for those with severe liver diseases. We learned that liver disease can occur due to various causes, including viral infections, alcohol abuse, and genetic disorders, among others. The liver transplant process itself is intricate and multi-staged, requiring extensive preparation and careful execution. It starts with the preoperative evaluation, a critical phase where the patient's eligibility for the transplant is determined based on factors such as the severity of liver disease, overall health status, and potential for recovery. We then delved into the manifestations of liver diseases and their anesthetic implications. We saw how liver diseases could present with symptoms like jaundice, fatigue, and abdominal pain, which can significantly impact the anesthetic management during surgery. The actual liver transplant surgery, the focal point of our discussion, consists of several phases. These include the removal of the diseased liver, the implantation of the donor liver, and the reestablishment of blood flow. Each phase has its unique challenges and requires the coordinated efforts of a skilled medical team. We also touched upon the guidelines for managing acute massive blood loss, a possible complication during liver transplant surgery. It's crucial to have a well-defined strategy in place, involving the use of both blood and non-blood products, to tackle such situations effectively. Finally, we stressed the importance of post-operative care in ensuring a successful recovery. This involves monitoring the patient closely for any signs of complications, administering necessary drugs, and providing support for physical and emotional recovery. In closing, liver transplants are an essential lifeline for individuals with severe liver disease. They require a thorough understanding of the process, meticulous preparation, careful execution, and diligent post-operative care. Remember, knowledge is power when it comes to health. Stay informed, stay healthy. We've covered a lot of ground today. From understanding the gravity of liver disease to the intricate process of liver transplants, it's clear that this is a complex topic that requires our attention. We've delved into the preoperative evaluation, the surgery itself, and the critical post-operative care. Each phase is crucial in its own right, and together they form a holistic approach to liver transplantation. This information is not just for the medical professionals amongst us, it's for everyone, because liver disease can affect anyone. The more we know, the better we can support those around us who might be going through this journey. If you found this content informative, don't keep it to yourself. Share this video and help others understand the nuances of liver transplants. This way, we can all participate in the conversation about health and wellness. Remember, every conversation about health matters. Keep the discussion going.